Have you ever wondered how doctors are able to see inside our bodies without making a single incision? The answer lies in a fascinating technology known as magnetic resonance imaging, or MRI. This medical marvel is a game changer in the world of modern medicine. It provides a non-invasive way to capture detailed images of our internal organs, tissues, and bones. From diagnosing tumors and infections to spotting injuries and abnormalities, MRI is an indispensable tool in a doctor's diagnostic arsenal. The best part, it doesn't expose the patient to radiation, unlike other imaging techniques. It's like having X-ray vision, but without the X-rays. This powerful technology has revolutionized the way we understand and treat a wide range of medical conditions. It's no wonder that MRI machines are a common sight in hospitals and medical facilities around the globe. So, MRI is a crucial tool in medicine, but how does it work? Let's dive into the fascinating process. When a patient enters the MRI machine, they are surrounded by a powerful magnetic field. But why is this important? Well, let's dive right in. The magnetic field plays a crucial role in the MRI process. This field is so strong that it's around 10,000 times the strength of the Earth's magnetic field. It is this strength that enables the MRI machine to interact with our bodies in a very specific way. You see, our bodies are largely made up of water, and water molecules contain 2 hydrogen atoms. When placed within the magnetic field of the MRI machine, these hydrogen atoms, or more specifically, their tiny nuclei, start to behave like tiny magnets. They begin to spin and align themselves with the direction of the magnetic field. Think of it like a compass needle aligning itself with the Earth's magnetic field. This alignment process is crucial because it sets the stage for the next part of the MRI process. Now, the magnetic field doesn't cause any physical changes in the body. Rather, it creates a scenario where the hydrogen atoms in our bodies are all spinning in the same direction, like soldiers standing at attention. This uniform alignment is what makes the next step possible. Once the atoms are aligned, we can then introduce radio waves. These radio waves are at a specific frequency that resonates with the spinning hydrogen atoms. When these atoms absorb the energy from the radio waves, they momentarily spin out of alignment. But as soon as the radio waves are turned off, these atoms want to return to their original aligned state. And as they do, they emit a tiny radio signal of their own. This emitted signal is what the MRI machine captures and uses to create images of our bodies. So the magnetic field is the first step in the MRI process. It's like the director of a play, setting the stage and getting all the actors in position. Without it, the rest of the MRI process just wouldn't work. But what happens next, you may wonder? Well, that's a story for the next scene. Stay tuned. After the hydrogen atoms are aligned, radio waves come into play, but what role do they play in the MRI process? First, let's get one thing straight. Radio waves are a type of electromagnetic wave. You can think of them as invisible light waves with much longer wavelengths. They're not just used for tuning into your favorite radio station, they're also essential in the MRI process. Here's how. Once the hydrogen atoms in our body are all neatly aligned by the magnetic field, radio waves are introduced. These waves are not just any radio waves, they're at a specific frequency, which we call the resonance frequency. This frequency is precisely what the hydrogen atoms need to absorb energy and get excited. Think of it like this. Imagine you're pushing a child on a swing. If you push at just the right moment, the child swings higher and higher. But if your timing is off, the swing doesn't go very far. That's resonance. In MRI, the radio waves are timed perfectly to push the hydrogen atoms to higher energy levels. But the atoms don't stay excited forever. When the radio waves are turned off, the hydrogen atoms relax. They release the energy they had absorbed, returning to their original alignment within the magnetic field. But here's the fascinating part. As they relax, they emit their own radio signals. These signals are like the atom's way of saying, "Hey, I'm here, and this is what I look like." Each type of tissue in the body, be it brain tissue, muscle tissue, or something else, has a unique signal. It's these signals that give us the detailed images that make MRI such a powerful tool. So in essence, radio waves are the secret sauce in the MRI process. They excite the atoms, causing them to absorb and then release energy, and it's this released energy that we detect and turn into images. Now that we've covered the role of radio waves, let's move on to the next step in the MRI process. After the hydrogen atoms release their absorbed energy, specialized antennas called coils come into play. But how do they contribute to the MRI process? Well, these coils aren't just your run-of-the-mill antennas. They are finely tuned to detect the radio signals emitted by the hydrogen atoms as they return to their original alignment in the magnetic field. Think of them as the ears of the MRI machine, listening in on the whispers of your body's atoms. Each emitted signal carries with it a wealth of information. The strength, frequency, and timing of these signals can tell us a lot about the type of tissue they came from and its location in the body. But to make sense of all this data, we need some serious computing power. Enter the MRI's computer, a marvel of modern technology. This computer takes the raw data from the coils and begins the process of image reconstruction. In essence, it's like putting together a complex jigsaw puzzle, where each piece is a tiny snippet of radio signal. To do this, the computer uses complex algorithms. These algorithms are designed to interpret the signals, taking into account their strength, frequency, and timing, and then translate them into a visual format that we can understand. This process is a bit like translating a foreign language into one's native tongue. The end result is a series of detailed images that show the structure of organs, tissues, and bones from multiple angles. These images are so detailed, in fact, that they can reveal abnormalities as small as a few millimeters. Whether it's a tumor in the brain, an infection in the spine, or an injury to a muscle, the MRI's images can help doctors diagnose a wide range of conditions. So from the magnetic field to the radio waves, and finally the coils, we've covered the basics of how an MRI works. But remember, each component is just one part of a larger orchestra, all working together to create a symphony of medical imaging. Each part, from the magnetic field to the radio waves and the coils, plays a crucial role in this complex process. MRI is a powerful tool, but it's not without its limitations. So, what are the pros and cons? Let's dive into the advantages first. The detail of images produced by an MRI is truly remarkable. By using strong magnetic fields and radio waves, MRI can visualize the structure of organs, tissues, and bones in great detail. This makes it an effective tool for diagnosing a wide range of conditions, from tumors and infections to injuries and abnormalities. Another significant advantage of MRI is its ability to produce images in multiple planes. This means that doctors can view the body from different angles, enhancing their understanding of the patient's condition. Imagine looking at a building from the front, then getting a chance to see it from the side and top. That's the kind of comprehensive view MRI provides. Furthermore, MRI can provide information about blood flow and tissue characteristics. This makes it particularly useful in cases where other imaging techniques fall short, like imaging soft tissues such as the brain, spinal cord, muscles, and internal organs. Now let's talk about the limitations. Patients with certain medical devices, such as pacemakers or metal implants, may not be able to undergo an MRI. This is due to safety concerns surrounding the strong magnetic fields used in the procedure. The experience of undergoing an MRI can also be uncomfortable for some. The machine can produce loud noises which can be unsettling, though ear protection is typically provided to mitigate this. Additionally, the enclosed nature of the machine can induce claustrophobia in some individuals. In essence, while MRI is a powerful and versatile tool, it is not suitable for everyone and can sometimes be a challenging experience for patients. MRI is an impressive piece of technology, but it's important to understand its limitations as well as its advantages. We've covered a lot of ground today, so let's take a moment to recap. We began with the importance of magnetic resonance imaging, or MRI, a non-invasive imaging technique that uses magnetic fields and radio waves to create detailed images of the body's interior. We then delved into the role of the magnetic field, which aligns the body's hydrogen atoms, and the radio waves, which cause these atoms to absorb energy. This energy is then released, emitting radio signals that are detected and sent to a computer to be processed into detailed images. We also discussed the pros and cons of MRI, highlighting its ability to image soft tissues and provide multiple views of the body, but also noting its limitations, including potential safety concerns for patients with certain medical devices and the discomfort of loud noises. So, whether you're a medical student or just curious about how things work, we hope this video has given you a deeper understanding of how MRI works and why it's such an important tool in modern medicine.